Today we are going to discuss the 2005 to 2006 outbreak of Fusarium keratitis. In 2006, the CDC received multiple reports of Fusarium keratitis cases among people that wore contact lenses. Fusarium keratitis is a serious fungal corneal infection that can lead to permanent vision loss or blindness. Symptoms of it include eye pain, eye redness, blurred vision, sensitivity to light, excessive tearing, and eye discharge. All of these cases were linked to the use of Bausch & Lomb's Renew with Moisture Lock contact lens solution. On the right side here, you can see a case of Fusarium keratitis that resulted in the need for a corneal transplant. The CDC confirmed 164 case patients in 33 different states and 1 U.S. territory by June 2006. The range of these patients were 12 to 83 years old, with 34% of cases requiring a corneal transplant and a shocking 94% of cases being from patients that wore soft contact lenses. The big issue is that Fusarium keratitis usually only occurs in tropical or subtropical climates. So in the United States, 35% of microbial keratitis cases occur in Florida, while only 1% occur in New York. When analyzing the situation, there are several factors to be considered when designing a solution to the issue. For example, we have to consider the healthcare costs associated with treating infected individuals, both on the patient side and the healthcare provider side. Additionally, we have to consider product recall. Bausch & Lomb's recall of the Renew and Moisture Lock had significant costs to the company. This incident not only affected the public's perception of the company, but also of the regulatory agencies such as the Food and Drug Administration that oversee all of the regulatory standards. Finally, we must consider not only the safety of the consumers affected by the outbreak, but also consumers of all other contact lens solutions and eye health products. When performing a SWOT analysis, we can identify one of Bausch & Lomb's strengths as their long-standing strong reputation in the eye health industry. On the other hand, we can identify one of their weaknesses as their strong reputation being damaged by the concerns about the company's product and safety standards. An opportunity while designing a solution to this outbreak is to implement higher levels of quality and safety controls. However, a threat to designing a solution would be the increase of production and distribution costs due to the regulatory standards. Although there were many complex factors resulting in this outbreak, the root cause was a failure of quality control and regulatory testing. Bausch & Lomb's contact lens solution failed to disinfect at proper levels for extended periods of time. This exposed the need for stricter regulatory requirements and testing to increase product safety and trust within big healthcare brands such as Bausch & Lomb. If regulatory requirements had been followed in the first place, this outbreak could have been prevented altogether. However, on the consumer's part, hygiene issues and non-compliance with recommended cleaning and storage procedures significantly increased the risk for infection by Fusarium keratitis. One solution to this issue would be improving product testing and development. By creating better and safer contact lens solution for consumers, cases can be significantly reduced. By highlighting the risks of wearing contact lenses and potential for eye infections, the importance and benefits of using safe contact lens solutions to protect eye health can be emphasized. Part of this solution includes helping consumers develop self-sufficient skills in using contact lenses and contact lens solutions. Another solution would be increasing regulatory testing, standards, and compliance. By increasing public awareness of the risks associated with the improper use of contact lens solution, we can emphasize the importance and benefits of stronger regulation over the development of products such as contact lens solution. With stronger regulation, there is a less likelihood for poor product quality, protecting consumer safety. The use of public health campaigns and media coverage can bring awareness and attention to the public's call to safer contact lens solution. These solutions align with the health belief model, covering all the bases of perceived susceptibility, perceived severity, perceived benefit, perceived barriers, cues to action, and self-efficacy. By aligning these alternative solutions with the HBM, it is possible to effectively address the underlying beliefs and behaviors that contribute to the use of unsafe contact lens solutions and promote healthier practices. Based on my analysis of the outbreak, my final recommendations for solving this problem in the future is to increase strict regulation and quality control and to increase education and awareness. By enforcing strict regulation and quality control, we can minimize the risks of infection and contamination, as well as preventing the problem before it actually occurs. This will reduce the likelihood of a public health crisis happening in the first place. Because some of the cases were exacerbated by poor hygiene and failure to comply with instructions, we must increase education and awareness surrounding contact lenses. This can be done by highlighting the risks associated with poor hygiene and teaching the public how to properly clean and store their contact lenses. Additionally, we can emphasize the importance of seeking medical attention in a timely manner when infection symptoms arise. That way, it can be treated before it becomes serious. To increase education and awareness of the public regarding contact lenses, several courses of action can be taken. Partnerships with trusted healthcare providers and professionals can lead to higher compliance with safety standards and instructions. With the current rise of social media campaigns following current trends can increase engagement with the general public. Partnerships with community organizations such as churches and schools can further increase engagement with local communities. The groups that would be responsible for implementing this action plan would be eye healthcare brands such as PUBHLTH, healthcare providers, and regulatory agencies such as the FDA. On the right here is a timeline following the course of action. For the first 6 months, initial planning is done, which includes developing marketing and social media materials, as well as establishing connections with groups that implement the plan. The initial launch of education and awareness strategies occurs over the next 6 months, and during that time period, the efficacy of the methods used can be monitored. After that time period, the efficacy of methods used can continue to be tracked and strategies can be changed if needed, adapting to changing trends and the needs of the public. By implementing these strategies, we can significantly improve consumer awareness and reduce the risk of contact lens-related infections. From 2014 to 2015, the National Reference Center for Invasive Fungal Infection in Germany received increased cases of Fusarium keratitis linked to the use of contact lens. The issues noted were the difficulty of treating Fusarium infections due to the resistance against antifungals, as well as rising cases with the popularity of contact lenses. Implications from this case included the need for improved diagnostic techniques, public health education, and healthcare provider awareness. In my opinion, connecting with the general public with more community-related efforts and increased use of relevant social media trends can significantly increase awareness to safety standards. By increasing regulatory oversight, cases of Fusarium keratitis can be prevented altogether, which is the strongest strategy for protecting the public health. Thank you for listening. Here is my bibliography.